Is same-day surgery the right choice for all patients, and what makes someone a candidate or not? So the answer is no, it's not the right choice for everyone. And I think one thing that we've learned is that patient selection is very important when it comes to looking at doing same-day or outpatient joint surgery. And there's a larger and I think growing group of people who can be successfully done the same day. And certainly it's something that in the right patient population, we offer to all of those patients. But properly screening them is a really critical process, because there are certain things that you just really need to be careful of if you're sending someone home the same day. And a few of the things that we look at are morbid obesity is one thing to think about, and as well as sleep apnea, and more specifically sleep apnea that requires a machine to wear at night. So we give a lot of anesthetics, and even though we're trying to limit opioids and different pain medications, they're all broken down by the body differently. And so I think about these things when I think about who is an appropriate patient to send for an outpatient or consider for an outpatient joint. The other issue is, when people think about outpatient joint replacement, they oftentimes think that these are associated only with a surgery center, freestanding surgery center. And there are a lot of surgeons who own freestanding ambulatory surgery centers, ASCs, or operate at them. And that's a great option for some patients. There's no question about it. You come in the morning. It's a very nice, usually very efficient process, different type of a staff, and you go home that day, and that's a great option. But a lot of same-day surgeries can be done in the hospital. We do it routinely, and at Rush they did it routinely as well. So you can just as easily come in, and if your hospital is geared toward it and you have the processes in place and the standardized protocols, you can come in the morning, you can have your surgery, you can go to the floor, work with physical therapy, and if your pain's controlled, you're ambulating on your own and you're able to manage stairs comfortably, then you can go home. And we do that routinely. And we do it routinely on patients who maybe aren't so sure if they want to go home. We also think about patients who, meet the criteria but have reservations. And if someone has a reservation, in my mind, they've sort of self-selected into the questionable category, even if they look great on paper. You have to really think about what their expectations are and what they're capable of doing. And so in those people, we'll take them into the hospital and we'll give them the option, and then we'll come see them after they work with therapy. And I would say 50% of those people will actually go home and they're surprised at how they feel and they can go home. And then the other 50% have some reservations or a little bit anxious. And so we give them the option to stay overnight, and that's totally reasonable. The majority of patients will go home usually the first day after surgery anyway. But I don't think it is for everybody. And I think that selection criteria is very important. And it's important because it will really reduce the complications in people who shouldn't be going home the same day.